You're listening to a podcast developed and produced by the Association of Asian Pacific Community Health Organizations, AAPCHO. To learn about AAPCHO, its members, or the principles and values that have guided this organization's work for more than 20 years, please visit www.aapcho.org.
Serving Locally, Leading Nationally is AAPCHO's latest podcast series, observing this year's theme for National Health Center Week. This series celebrates the crucial role of community health centers in providing high-quality healthcare and community development opportunities to many of the most medically underserved populations across the United States. Dr. David Derauf is the Executive Director at Kokua, Kalihi Valley Comprehensive Family Services. In this two-part episode, David speaks with AAPCHO's Communications Assistant, Beverly Quintana, about KKV's community-centered healthcare approach and whether it is in alignment with the current community-centered health home concept. You actually answered my next question. I was going to ask you about the nature preserve. Did you want to say anything further on future plans for expansion for the project?
There are just so many different aspects of the work that are going on. I think most importantly, what we're really excited about is to see how many different ways there are for members of the community to engage themselves in a really diverse and productive ways on the land there. And as a model, that connection between healthy land and healthy people is very clear and easy to see within Hawaiian culture. So it's a wonderful thing to have people come and visit us on the land in the back of the valley, and almost to a person, irregardless of where they came from, whether it's Samoa or the Philippines or Vietnam, to say, oh, this is like home. I mean, I think to us, there's a lot of talk these days about the patient-centered medical home, but we're just as interested in finding out where our patients feel that home is. The medical home model is a wonderful thing to the extent that people can say that they have a very familiar and sustained relationship with a caring medical provider based on continuity and strong relationships. Indeed, if your orientation is towards patients, then you're going to be asking, where is the home for their health? What does that look like? And I think for most people, that's a healthy community. If we're serious about it, if we take that patient-centeredness to heart, leads us in the direction of the community-centered health home.
Why are these efforts, in addition to what you're doing in the clinic, so important to improving health outcomes?
From an epidemiological perspective, from a public health background, the primary determinants of health and well-being, we believe we know what they are from an epidemiological perspective. And what are those? Well, they are personal behaviors, including things like exercise and diet and tobacco use and the like. They are social connectedness or social capital. They are the physical environment in which you live. And they are your economic status. And finally, they are access to good primary health care, I should say. So amongst those, as community health centers, we have in recent years been devoting, well over 90% of our resources and efforts and thinking to that last one, the access to primary health care. And it's understandable why that should be. First and foremost, it's what we get paid to do, so that the incentives lie in that direction. But also it's our training and our orientation have led us to, mistakenly I would argue, think of access to health care as the predominant or primary determinant of health and well-being. When indeed, when we look at some of the others, social capital, your personal behaviors and your physical environment, and your economic status, I think those are overwhelmingly more important for your health and well-being. It behooves us, as difficult as it may be, to ask ourselves, what is it we can do to regain even a portion of our emphasis on those other factors? How is it that as community health centers we can set about doing that? It's an uphill battle. There are very few rewards and incentives on a financial basis, certainly, for taking this other orientation. I think the rewards are much more likely to be personal. For example, I think many physicians who are drawn to work in community health centers feel somewhat powerless or helpless to change the conditions in which they see affecting their patients' lives. And so there's sort of a growing sense of frustration. And oftentimes I think those social determinants are treated somewhat as Pandora's box. You wouldn't dare open it in the course of a 10 or 15 minute medical visit. The starting point is just to say, it's overwhelming. Now what do I do about it? Maybe I don't have the right training and background. Maybe we can't do that alone. Who do we need to partner with? But I think the starting point is really to rather than to run away from that feeling, to confront it head on and to be quite honest about the importance of those other factors in the health and well-being of members of our community.
This podcast was brought to you by AAPCHO. Please join the conversation on our Facebook fan page at facebook.apcho.org and tune in for our next podcast at www.aapcho.org.